into a little bit of the supernatural part, where I'm going to start tossing some questions at you that might be outside of your personal experience. So if you could just answer them as seriously as possible, that would be awesome.
Yeah, no problem.
Okay, so there are shapeshifters in my book,
Okay.
and the large animal vet character is going from not knowing anything about the hidden world to being introduced to the fact that there are people who can look like animals, and she's kind of thrown into this situation where she's an emergency field medic for some of them. So just off the top of your head, if you were responding to, an emergency medical call for an animal, and there was the possibility that this was actually like a sentient human type consciousness, how would it change your approach? How would you react to something like that? Assuming you couldn't pull in outside help.
Yeah, I think. Well, at first I'd be nervous, just because I'm not trained. If I knew that there was kind of a human aspect to whatever animal I was dealing with, I would. I'm not trained to work on humans. But the
Right.
main thing I'd want to do is whatever procedure I'm doing, want to really make sure my pain control is fine. 'Cause I know animals tend to have a higher tolerance for pain than a lot of humans. So whatever procedure I was working, whatever procedure I was performing on the creature, I would want to make sure that my pain protocol was on point, just to cover my bases there. Especially since if it is kind of a sentient being who I guess has the ability to kind of to be a human, then I'd be more worried about the legal aspects in terms of.
That's hilarious. I hadn't thought about that.
Yeah, just because with animals, they can't really help people if they think they're being mistreated, and if it was a sentient animal, it might be able to tell us if
Right.
it's being mistreated. So.
Okay, so what are
So
you
yeah,
using for pain management in this instance? Like, if the creature's injured, what are you using for pain management?
I would primarily use opioids in this case, just because, especially if it had a human aspect to it. Because in equine medicine, we do use a lot of uromocidin and xylazine, which they're called alpha-2 agonists, but they are not good for humans. So they work very well in animals, but in humans, they're fatal. So
Oh,
if I knew that whatever I was dealing with had a human component to it, I would stay away from the alpha-2 agonists and primarily use an opioid. So the one I would probably use would either be a good bit of morphine or butorphanol, which would probably be my go-to, just because I know opioids are. It's you can still overdose a human on opioids, but we know that they have more. They're more reliable in people than an alpha-2 agonist would be.
okay.
Um, if that makes sense.
Yeah, the idea of certain medications being fatal to humans but not to equines is something that it seems obvious now that you're saying it, but it's not something I considered, so that's a great detail. Have you ever dealt with like an aggressive animal? I mean, I know you mainly work with horses, but they can get scared and shy and upset. So if you come to a scenario where there's an animal that's suffered an injury or not feeling well and they're acting aggressively, what's your protocol for that?
So the main protocol is to get someone handling the animal who's competent. So the especially when you're dealing with an angry or aggressive animal, having a competent handler is probably going to be the most important first step. And then once that's under control and you have someone who's good at handling that animal, then getting some tranquilizer in the animal is important. So, and if I was dealing with and going back to if the animal had a human component,
Right.
I'd switch to I would also continue to use either like a ketamine or a opioid to kind of sedate the animal. Because those medications have good pain properties, but they also do a good bit in kind of taking the animal to calming the animal down and taking it to like a different place. So, yeah, first step, get a good handler. Second step, get some sedation or tranquilizer in the animal to calm it down and get it more tractable and so we can handle it.
Have you ever had to, or do you know what the protocol would be for treating gunshot wounds in an animal?
I personally have never treated one, but I'm familiar with how I know how I would go about treating one. So I can tell you.
Yeah, if you want to dive into that, the plot in my book is that there's a poacher in the park and that he accidentally shoots one of these shifters. So you've kind of got this scenario where it's an animal form but a human component, and the vet is trying to treat for kind of like first aid for gunshot wounds before she calls in help from other professionals.
Okay. Yeah. So the first thing I would do would be to sedate the animal to keep it calm, and possibly even do field anesthesia, which would be ketamine, which would make the animal lay down and basically sleep, still be somewhat aware of what's going on, but not really able to move. It's not really a paralytic, but the animal would be down and kind of not able to move and in their own world. Then I'd clean the gunshot wound. One thing I'd be curious about is seeing if there's an exit wound. So there's the entry point, which is usually smaller, and then if the bullet made it out the other side of where the animal was hit, then there's going to be a larger exit wound on the backside. So I would examine the animal for an exit wound, just because if there is an exit wound, then the bullet's probably not in the animal anymore. So but I'd find the entry point, look for an exit wound, clean both of those with. I would use antiseptic, so betadine and chlorhexidine usually work well for me. So clean the area, and if there's any active hemorrhage, I would apply pressure and try to either tie off any vessels that are bleeding if I can find them, or just pack it. So to pack the wound with usually they make things like Quick Clot, which is a product, but also just cornstarch will work too. So if you just got if you got a bag of cornstarch, it can work. It can work. Maybe not for like an arterial bleeder, but if there's a smaller vessel that's bleeding, cornstarch can work to clot. And then once the bleeding and everything is somewhat under control, then I would be comfortable exploring to some degree to see if there is no exit wound, exploring a little bit to see if I can find a bullet and pull it out. Because that bullet will just serve as a source of infection later on if we can't get the bullet out. But if there doesn't seem to be a bullet in there, and we stop the bleeding and we kind of we pack that wound, and I would bandage it just to prevent further infection. I would start the animal on some antibiotics. So broad spectrum antibiotics would be the route I would go. So something that covers both gram-positive and gram-negative bacteria.
Is that injectable or oral, or how are you administering?
For a gunshot wound, I would do injectable.
Okay.
So, yep.
Okay, and you said something earlier I just wanted to loop back to. You said tying off you said something about tying off something that was bleeding, and I didn't totally understand. Can you go into that in a little more depth?
Yeah, that's fine. So, anytime a blood vessel is broken, so if like a vein or even an artery, hopefully not an artery, but if a vein gets snapped, then it's bleeding. So what the idea is we take a suture and we go around that vessel, so where the vessel is bleeding, where the blood vessel is bleeding from, we basically tie around that and we try to cinch it. So what that does is it pulls that vessel closed. So it's in some ways it's occluding that blood vessel. So
okay.
Basically, we tie a knot around that to basically hold that vessel shut and stop the bleeding.
Okay. Okay.
A lot of times they will wind up losing use of the vein, but it's better than having them bleed out. So.
Okay. Interesting. All right. Switching gears a little bit from trauma, because I also have kind of like supernatural parasites in my book, and I wanted to take a minute to talk to you about parasite management. If I know, like from having goats and horses and stuff, that you give them dewormer pretty regularly for or as needed for intestinal parasites and things like
Right.
that. But if you suspected a parasitic presence that was like more in the sinuses or nasal cavities or something kind of atypical, how would you go about exploring that and treating it?
So if it's a parasite that I haven't seen before, or certainly if it's a foreign parasite, I would go about just treating with probably the most common medication that works in the vast majority of parasites, which is going to be either ivermectin or moxidectin. Both of those are drugs that work very well in taking care of most forms of parasites. The exception is going to be tapeworms, but if tapeworms don't, I've never heard of a tapeworm being in a sinus or
Yeah,
or kind of
perish the
head.
thought.
Yeah, that would be odd. So I would certainly start with kind of a broad, very effective dewormer. That the reason I would be, and in this case, especially if it was a bug or a worm that I'd never seen before, I would not have any reservations using ivermectin, but or moxidectin.
Is
But
that taken orally again?
Yep, that's something we would squirt in their mouth. Yep.
Okay.
Yeah, we just not want. We try to preserve those two dewormers because resistance is an issue with worms in animals. So we try to use those sparingly because we don't want to promote resistance for moxidectin and ivermectin just because they're such valuable dewormers. But if it seemed kind of like a novel parasite, the odds that it has for some resistance to ivermectin or moxidectin are pretty low. So I would be comfortable using that.
Okay, what's the treatment time for that? Like once you administer it orally, how long does it take to have an effect?
In most, it's a fast killing product. So most times the worms are dying or decreasing in within a week.
Okay. This is super helpful, and I'm really excited about going back to my rough draft and filling in the details. Stuff like this makes a huge difference. It's like the difference between reading something that you can tell the person doesn't really know what they were talking about, and reading something where you're like, oh yeah, this makes sense. So I really, really appreciate this. This is super cool.
Yeah, it's my pleasure. It's interesting. I'm kind of interested in taking a look at the book when it's all ready.
Yeah, I will absolutely send you a copy, and I don't know exactly when that's going to be. I'm finishing up the rough draft now and kicking it to beta readers, and then I haven't.
I know it's a long process. So.
Yeah, it is. But this is a fun one, and it's fun to set it locally too, and kind of have the rural Virginia feel, and be able to pull on my love of cryptids and kind of things that go bump in the night. So I'm looking forward to it, and I appreciate your help.
No, it's my pleasure.
Okay, thanks so much. If you don't mind, if I remember any questions I forgot to ask you, I'll just text you, but I think this gives me 99% if I haven't forgotten anything. So that's awesome.
Oh, well, good. I'm happy to help. And if you have more questions, feel free to text, and I'll do my best to answer.
Okay, thanks so much. Have a good night.
Yeah, you too. Good night.
Yep, take care. Bye-bye.